Hello and welcome everyone. My name is Adam Wood and I'm going to be taking you through your introduction to pharmacology. And so this is just going to be a brief course introduction just to give you an idea of what to expect in this course and kind of see how things are going to be going, kind of what my goals are for the course, and hopefully that's going to line up with what your goals are going to be for the course as well. So just to start off, I want to tell you a little bit about myself to let you know that, hey, I'm probably at least a little bit qualified to teach this course here. I've been a pharmacist since 2010. I actually went to the University of Florida College of Pharmacy, where I graduated from there, like I said, in 2010. And then I really took an interest in clinical toxicology and emergency medicine, which are some things we'll talk about during this course here. So from there, once I graduated, I went ahead and did a 2-year fellowship in those two disciplines at the Florida Poison Information Center. So that was another 2 years of training I did there in that fellowship. And then once I graduated, I moved down to the Orlando area, where I was actually the first emergency medicine pharmacist that worked down at Nemours Children's Hospital. Actually, we started up the pharmacy there in about July 2012 and then opened in October. And actually, I still work there. I'm there 1 day a week now as part of my sort of clinical responsibilities that I still have as a pharmacist. But I ended up leaving full-time work at Nemours and moved on over to educating at Nova Southeastern's physician assistant program, which I have here in Orlando. So I've actually been doing that as an adjunct for a couple of years, and then I moved into full-time education there, where I do all of their pharmacology curriculum and also do a lot of their research curriculum and things like that. So that's a big reason why I wanted to teach for UCF, is because I saw so many applicants that come from your school that come to our program. And so I thought it'd be really neat to have an opportunity to sort of have an influence on at least some of you, even before you come to join us at the PA program in Orlando, if that is what you so choose. But to get a little bit into the course here, basically this is just a brief introduction into pharmacology. Obviously, you're not going to know everything about pharmacology by the time you leave this class here, but I at least wanted to give you a little bit about the basics of how, why, when we give medications, right? Like, how do you choose one drug versus another? Who's a good patient for a particular type of therapy, etc. And what it really comes down to, and it actually is irregardless of what your feelings are on medications, whether we use them enough, too much, or too little, whether you're going to eventually be a physician, a nurse practitioner, a physical therapist, a pharmacist potentially, you're going to run into medications. Even if you don't run into patients who use medications, you yourself might use medications, which is why I think it's so important to at least have some passing familiarity with this stuff. And then I like to utilize a lot of real-life examples to kind of illustrate key concepts that we're going to talk about. Again, my background is in emergency medicine and clinical toxicology, so most of the time it gets into a lot of illicit substances and ways that people try to harm themselves, either intentionally or unintentionally. So some people find that stuff sort of interesting. So we'll kind of go over examples like that to try to drive home some of the key concepts we're going to talk about in the course, and then hopefully get you interested in the different aspects of medicine, right? So whether or not you want to be a physician, nurse, etc., you at least have some passing interest in hopefully medications, and don't think about it as just being the most boring thing in the entire world. You might actually think that at the end of this course, but I'm hoping to at least ease people in a little bit to let them know that, hey, there's maybe some more interesting things to this than you might think. And again, my goal is not to make you little mini pharmacists by the time you get out of here, and so I really want to focus on what is the most applicable sort of true to life sort of things you can take away from this, and not really get lost in the weeds in terms of things that really only pharmacists would need to know, or really those kind of minutia sort of things that most people really don't even care or think about. And so again, that's not one of my goals, is to make you a pharmacist. But again, if you chose to go that route, there's certainly a lot more depth that we can get into. So looking at your grades, how this is going to be made up, basically a lot of this is going to be either discussion board posting, so there'll be one of those roughly for each module. Again, I've randomly assigned the groups already to about 15 students apiece, and so those will open up Monday night about 1 a.m. and then they'll be due by Sunday at 11 p.m. I believe is how I have it set up. And so basically you'll go in, you'll have a prompt that you'll go through and answer the questions. You actually won't be able to see anyone else's post until you post your own, and then you need to respond to at least one other student. Again, a nice, thoughtful sort of response, not just like a, yeah, I agree, I disagree, etc. is not really all that useful there. So that'll be 35% of your grade. Going to some of the written assignments, these will be based off of chapters from the book, which hopefully you've all have purchased. And so from there, you'll have, again, some prompts. And most of those responses should be in sort of paragraph responses. I don't expect you to write entire books with these things, and I really don't want to read entire books. So try to keep it succinct but thorough in your responses. And I'll provide feedback to kind of give you some guidance here and there if need be. It will have a plagiarism review with Turnitin, so make sure when you turn it in, it's not something that is coming up completely 100% red because you copy and pasted something. I expect a lot of professionalism out of you guys, just like you would expect it from me. So again, that is one way we use Turnitin to try to help, kind of prevent any of that plagiarism from occurring there. So that's another 35% of your grade with just the written assignments. Graded quizzes are going to be another 20% of your grade, and so there'll at least be 1 to 2 of these every week. Again, you can do them whenever you want. They're open book, but they can pull really from anything. So it could be from the PowerPoints that I post. It could be from the narrations. So I actually do want you to watch the videos that will be accompanying the PowerPoints. Those will usually just be a YouTube link that I'll upload, very similar to how I'm going to do with this one. Really, anything is fair game from that standpoint. So again, I want you to make sure to at least be aware of that, so that way you're not kind of blindsided when you get into the quizzes. The quizzes might have different answer or question types, so you might find there's some matching, might be some true false, might be some fill in the blank, that sort of thing there. That's going to be a little bit more freeform. The final exam, which is that last 10% of your grade, is going to be the same as the quizzes in terms of it being open book and being able to pull from anything, textbook, PowerPoints, narrations, etc. That is going to be a little bit more formalized in a 50-question, 4 multiple choice answer sort of exam. It'll be pretty straightforward. I think you have like 180 minutes on that one, so there's plenty of time to get through that, and I don't expect many people to actually need the full time. So that is roughly 100% of your grade. If I can do any sort of math, I believe that is 100%. Yeah, and we can go from there. So again, when you're getting into pharmacology, remember, especially when we get into the drugs, that this is a new language for you. So practice saying the words, kind of go through things multiple times, because that will help to kind of cement it in your head. Anything you take from here can be utilized in future practice when you get into whatever sort of post undergrad, teaching or programs you get into. So again, try to ingrain some of the stuff, because it will be pretty practical information for the most part. And use your resources, right? The book is got a plethora of good information in there. Talk to your fellow students and maybe able to help you out. And then again, I'm probably going to be the best person to contact if you have any issues or questions. Email is the best way to reach me. That is in the syllabus, which you can check out in Canvas. Again, try to at least give me 2 business days or so to respond back to you. I'm generally much quicker than that, but at least that is the bar to clear. And then I have office hours. Those are going to be Thursdays from 8 to 9 a.m. I know it's a little early, but I do have other workplaces I must get to, so it kind of is what it is. It's going to be in the HPA 2 building, room 218. I will not be there, though, Thanksgiving Thursday. Again, you'll have to forgive me for that. As always, if you have any issues, even if you anticipate issues that might not truly come up, please try to reach out early. And remember, there are no stupid questions. You have presumably no previous experience of pharmacology, so there are no such things as stupid questions. Feel free to ask it. The only person that it really doesn't benefit to not ask it is you, so make sure you try to reach out if you can. Anyway, so that's it for this introduction. If you have any questions, let me know, and I will see you guys around. Thanks so much. Bye.